This recorded review will be going over the MedSurg 1 Exam 5 Study Guide, starting with Chapter 17, the cardiovascular system. What are some strategies specific to women to prevent heart disease? We can see this on page 381 in the green health promotion box, preventing cardiovascular disease in women. Women should incorporate stress reduction techniques into their daily lifestyle because increased stress is a risk factor for cardiovascular disease. Define diastolic pressure. What does this mean? What is the heart doing at this time? So we can see this on page 379. Diastolic pressure is the pressure when the ventricles are in the relaxation phase, or diastole. This occurs just before the next contraction of the ventricles. So in this state of diastolic pressure, the ventricles are relaxed. Why is the older population prone to heart murmurs? We can see this on page 380. The cardiac valves become thickened, particularly the mitral and aortic valves. These are subject to higher pressures. A systolic murmur is common in those older than 80 years of age. Murmurs are common due to insufficient valves. Why are arrhythmias common in the older population? We can also see this on page 380. The SA node loses about 40% of its pacemaker cells over time. This predisposes the older adult to cardiac dysrhythmias, or SA node failure. Be familiar with the questions that should be asked during data collection for the cardiovascular system on page 392. So on page 392, you want to pay attention to that purple focused assessment box. And specifically, you want to pay attention to the questions that they're asking, maybe about weight and swelling. Why is weight gain or changes in clothing fit an important concern for a patient at risk of cardiovascular disease? So this is important for your daily weight, because it can be an indicator of any weight that the patient may be putting on. Sometimes they'll notice this with tightened clothes, and we can see this. We can see this on page 401 in the purple clinical cues box. A weight gain of 2 to 3 pounds or more in 2 to 3 days or less can indicate fluid retention. Diabetic patients are at a higher risk of developing cardiovascular disease. How can they modify their risk? Diabetic patients are at a much higher risk of developing cardiovascular disease. And we can see how they can modify that risk on page 383 within table 17.1. Take a look at the modifiable risk factor diabetes. You can provide means to modification by maintaining a good glycemic control by keeping the blood glucose within normal limits. It should be below 100. What is the purpose of a venous ultrasound of the legs, also known as a Doppler flow study? We can see this on page 385 within table 17.2, common diagnostic tests for the cardiovascular system. The venous ultrasound of the legs, also known as a lower extremity Doppler, purpose is to assess for occlusion or thrombosis within the vein. What are some nursing implications for the patient who returns to the unit after a cardiac catheterization? We can see this on page 388 within that same table 17.2. See cardiac catheterization and nursing implications. The EKG leads, BP cuff, oxygen saturation monitor, and carbon dioxide monitor should be in place during the test. The nurse must place the oxygen saturation monitor on the patient as soon as they return to the unit. What are some instructions the nurse needs to give the patient who is about to undergo a stress echocardiogram? We can see this within that same table, 17.2, on page 385. See stress echocardiogram and then look at the nursing implications. Explain the procedure and the importance of returning to the examining table immediately after exercising. Define intermittent claudication. We can see this on page 391. Intermittent claudication is cramping pain in the muscles brought on by exercise and relieved by rest. Define bruit. We can find this on page 394. A whooshing or purring sound is a bruit. This is made either when blood passes through a turbulent area of an artery, possibly caused by partial obstruction, or when the blood is flowing rapidly. To detect a bruit, you must listen with the bell of the stethoscope applied lightly over the skin, over the carotid arteries, abdominal aorta, or the femoral arteries. How should the nurse proceed if they hear a murmur or a bruit during the assessment of the patient? So again, I just kind of answered that. You would listen with the bell of your stethoscope applied directly over the skin of the carotid arteries, the abdominal aorta, and the femoral arteries. We can also see more about murmurs on page 394. The bell of the stethoscope is used to listen for heart murmurs. It should also be placed lightly on the skin for sounds to be heard. Murmurs will typically have a swooshing sound from turbulent blood flow. They are commonly the result of damaged valves, causing abnormal blood flow in the heart. According to the textbook, how should a normal pulse be graded according to scale? So we can also see this on page 394 within box 17.2, Scale for Grading Pulse Quality. Note that a +3 indicates a normal volume. Define pulse pressure. What is the pulse pressure for this reading? 180/90. You can see pulse pressure on page 379. The difference between the systolic pressure, the difference between the systolic blood pressure and the diastolic blood pressure is known as pulse pressure. So what is the pulse pressure for 180/90? It would be 90. You take 180 and you minus 90, and then you get your pulse pressure answer. So systolic minus diastolic. How will a patient's skin appear if suffering from arterial insufficiency? We can see that on page 395. Return of color to the lowered feet can be delayed in arterial insufficiency. If there is severe peripheral arterial disease, the dangling feet can take on a dusky red color. This is known as rubor. The skin may also be shiny and taut. Skin that is chronically malnourished because of decreased blood supply will have a characteristic appearance. It will appear smooth, shiny, and thin. There will be little to no hair on the surface, and the nails will be thick and yellow. Chapter 18, Care of Patients with Hypertension and Peripheral Vascular Disease. Define hypertension. We can see that on page 405. Hypertension is defined as persistently high blood pressure. This means a systolic pressure that is equal to or greater than 130 millimeters of mercury and a diastolic that is equal to or greater than 85 millimeters of mercury. This must be taken at least twice and averaged on 2 separate occasions that occur 2 weeks apart. Be familiar with safety measures to prevent falls for patients with orthostatic hypotension. So we can see these on page 408 within the blue patient teaching box. Safety measures to prevent falls for patients with orthostatic hypotension. It would be important to study all of those bullet points. Define and understand hypertensive crisis. We can see this on page 412. Remember that hypertensive crisis is an umbrella term that covers hypertensive emergency and hypertensive urgency. Hypertensive urgency occurs when the blood pressure rises to 180/110, but there are no signs or symptoms of target organ disease. So you have the elevated blood pressure without any associated signs and symptoms. That is hypertensive urgency, which falls under the umbrella term of hypertensive crisis. List foods high in potassium. Patients taking which medication should increase their intake of these foods? So I may have said potassium in that previous sentence, but that was an error. We want to look for strategies the patient can follow to decrease sodium in their diet and what foods would need to be avoided. So we can see this on page 413 in the red nutrition considerations box about decreasing sodium in the diet. And notice in the last bullet point, the items that are high in sodium. This would include ketchup, soy sauce, steak sauce. These are all high in sodium, and they should be avoided. What is the purpose and use of aspirin in cardiovascular disease? We can see this on page 416 going into page 417. Antiplatelet agents and platelet inhibitors can be used alone or in combination with other drugs. Aspirin is the most commonly used antiplatelet agent. It will prevent the aggregation of platelets in the arteries. What is a PTA and who could receive this? We can see this on page 417. Percutaneous transluminal angioplasty, or PTA, can be performed to open an artery to reduce claudication symptoms and improve extremity perfusion. A catheter is introduced into the artery, and when the proper spot is reached, a balloon is then inflated multiple times to dilate the vessel, which will promote better blood flow. By removing the plaque, the diameter of the vessel is enlarged. This allows for increased blood flow. Stenting is typically performed to maintain vessel patency. Interventional procedures can prevent the need for open surgical intervention. A patient with PAD, a normal ABI, and complaints of claudication would be a good candidate for a PTA. List some strategies the patient at risk of varicose veins could implement. We can see this starting on page 427 and going on to page 428. Individuals who must be on their feet with varicose veins are encouraged to wear support stockings to promote venous return. For patients with varicose veins, prolonged standing, sitting, or crossing the legs should be avoided. Exercises such as walking or swimming can be beneficial because the muscle contraction will encourage venous return to the heart. List some signs and symptoms of chronic venous insufficiency. We can see this on page 429. Signs and symptoms of chronic venous insufficiency include chronically swollen legs, thick brownish skin around the ankles, and itchy, scaly skin. What discharge instructions should be given to a patient who just had an endovenous occlusion laser treatment? We can see this on page 428. Endovenous occlusion using a laser is performed by placing a catheter within the vein under duplex ultrasound guidance. A laser then heats the vessel, causing it to collapse and close off. This can be performed in an office setting or an outpatient ambulatory surgery site. Compression stockings should be worn for 1 to 2 weeks after the procedure. The patient should ambulate immediately after the procedure for 30 to 60 minutes and then for 1 to 2 hours per day for the next 1 to 2 weeks. How should the nurse treat a venous stasis ulcer? We can see this on page 429. Treatment for an ulcer consists of leg elevation, a moist dressing, and compression. The dressing to be used will depend on the condition of the ulcer and the amount of exudate produced. Compression dressings are not used if arterial insufficiency is also present. Compression therapy options include compression stockings, elastic tubular support bandages, intermittent compression devices, a paste bandage such as an UNA-boot, or placement of 2 to 4 layers of compression dressings. Compression dressings can be placed over wound dressings. These dressings can help reduce ulcer pain, keep the wound moist, and assist with debridement. The dressing should be changed every 2 to 3 days to every few weeks, depending on the type of dressing that you apply. But patients with venous stasis ulcers can benefit from occlusive compression dressings. Can compression dressings be placed over wound dressings? Yes, I already answered that one, and that would be found on page 430. How is a deep venous thrombosis treated in the hospital setting? We can see this on page 424. Inpatient medical treatment for DVT usually consists of IV heparin. And for the foods high in potassium, we want to look on page 410 within box 18.1, General Nursing Interventions for the Administration of Diuretics and Antihypertensive Drugs. So patients taking diuretics especially need to increase their intake of high potassium foods, at least 1 per day. Foods high in potassium include bananas, orange juice, cereals, meats, tomatoes, potatoes, and raisins. They should be eating at least 1 daily unless they are taking a potassium-sparing diuretic. Chapter 19, Care of Patients with Cardiac Disorders. What is the first sign of right-sided heart failure? We can see this on page 436, in Table 19.2, Comparison of Left-Sided and Right-Sided Heart Failure. You can also see this in the paragraphs beneath that table. Primary right-sided heart failure is commonly caused by chronic pulmonary disease. It will produce edema. When the right side of the heart fails, the edema is first evident in the lower extremities, so you'll expect to see dependent edema within the lower extremities. lists signs and symptoms of left-sided heart failure. So we can also see that on page 436 within that table 19.2. Signs and symptoms of left-sided heart failure include fatigue, dyspnea, wheezing, orthopnea, pallor, clammy skin. What is the purpose and action of an ICD? We can see this on page 451. Implantable cardioverter defibrillators, or ICDs, are used for patients who have an episode of a life-threatening dysrhythmia. They monitor the heartbeat and provide an electrical shock similar to that delivered in cardiac defibrillation or cardioversion whenever a life-threatening rhythm is detected. What medication can we give to CHF patients struggling with shortness of breath? We can see this on page 438. Morphine is prescribed if pulmonary edema is present. This is to relieve anxiety and make breathing easier. Morphine can relieve air hunger. How should activity be scheduled for a patient with CHF? We can see this on page 442. Assisting hospitalized patients with activities of daily living will decrease their oxygen demand. Scheduling all activities to promote as much rest as possible is a high priority. Activities should be alternated with rest throughout the day. Which dietary recommendation should patients with cardiac arrhythmias follow? We can see this in the purple clinical cues box on page 445. Anytime a person states that they have noticed an irregular or rapid heartbeat, you should ask them how much caffeine is being consumed every day. If their consumption is minimal, ask about medications being taken, such as any decongestants. You should also ask about their stress level. The problem could disappear when the precipitating factor has been removed. Why do we need to monitor heart rhythm, blood pressure, and pulse when administering amiodarone? We can see this on page 449 within table 19.4, drugs commonly used to treat dysrhythmias. Amiodarone. Look at the nursing implications. We must monitor heart rhythm, blood pressure, and pulse because it is an antidysrhythmic drug. Which arrhythmia is considered the most fatal? Amiodarone can also result in hypotension. That is one of the additional reasons that we want to monitor that heart rate, blood pressure, and pulse before giving the drug. Which arrhythmia is considered the most fatal? We can see that on page 447. Ventricular fibrillation is a chaotic random firing of all ventricular cells. The ventricles will quiver rather than actually contracting. So there is no cardiac output, and without CPR and defibrillation, death will occur. So ventricular fibrillation is the most fatal arrhythmia. Describe the action of calcium channel blockers like verapamil. We can see this on page 438. Within table 19.3, drugs used to treat heart failure. Calcium channel blockers, an example is verapamil. The use is to produce vasodilation and reduced heart rate. Verapamil inhibits transmission of the impulse from the AV node. The patient requires temporary pacing. What can the nurse do to ease the patient's discomfort? We know that temporary pacing can be a very painful procedure for the patient because you are actually shocking the heart from the outside of the body. Whenever possible, we do want to pre-medicate these patients. And we can see this on page 450. Electricity is passed through the chest wall via external pads. This causes uncomfortable muscle contractions as the current passes through the chest, so this should only be used until another mode of pacing is available. A temporary transvenous pacemaker will be placed if a transient rhythm, such as a heart block, develops after MI or drug toxicity. Patient consent is required, and a sedative should be given to the patient before the procedure. What are some instructions that need to be given to the patient who is being discharged with a permanent pacemaker? We can see this on page 451 within the blue patient teaching box, instructions for a patient with a permanent pacemaker. The patient should avoid lifting any heavy objects. They should avoid lifting the arm away from the body on the pacemaker side until the healthcare provider says they can progress to normal activity. Lifting can actually dislodge leads from their positions. The patient should keep the incision dry for at least 4 days after the surgery. They should check for redness, swelling, drainage, and fever and report these findings to the healthcare provider. They should refrain from any activities that could cause a direct blow to the pacemaker. What is another name for digoxin? List signs and symptoms of toxicity. We can see this on page 449 within table 19.4. Digoxin is also known as lunoxin or digitalis. Patient teaching would include teaching the patient signs and symptoms of toxicity. This includes visual changes, anorexia, nausea, vomiting, diarrhea, headache, confusion, and a new dysrhythmia. Which patients are at a higher risk of developing aortic stenosis? We can see this on page 455. This is in the red older adult care points box. Older adults with long-term hypertension are at risk for aortic stenosis due to their increased atherosclerosis and stiffening of the aorta. You should carefully assess the aortic valve sounds of older adult patients, especially if hypertension is not well controlled. And why is it so important to weigh our heart failure patients? We can see this on page 440. Obtain an accurate weight, and you should know what the trend of weight has been. Also see the purple clinical cues box on page 440. It is important for patients who have been diagnosed with heart failure that is well controlled or compensated to weigh themselves every day at home and then record that weight. If the patient can see that fluid weight gain is occurring, they may be able to avert a trend back into the decompensated heart failure by adjusting their diuretic medication, decreasing their sodium intake, treating any infection, and decreasing activity and resting more. Also see on page 437, a weight gain of 2 to 3 pounds in 24 hours or 5 pounds in 1 week will occur as fluid is retained. Dyspnea will be present and crackles and wheezes can be heard in the lungs. Chapter 20. Care of patients with coronary artery disease and cardiac surgery. Describe coronary artery disease. Why would a patient experience angina in the setting of coronary artery disease? So we can see this on page 461. Coronary artery disease is a progressive disease leading to narrowing or occlusion of the coronary arteries. The coronary arteries are responsible for supplying oxygen and nutrition to the myocardium. As the coronary vessel narrows, the patient can experience symptoms of ischemia, including chest tightness and angina. When a sudden obstruction to blood flow through one or more major coronary arteries occurs, it will cut off oxygen and nutrients to the cardiac cells, leading to an MI. With rapid intervention, the amount of infarcted tissue can be limited. Describe what happens during an MI. So kind of just did that as well, but when a sudden obstruction to blood flow through one or more major coronary arteries occurs and cuts off the oxygen, then the obstruction causes the blockage, it cuts off the oxygen and nutrients to the cardiac cells, and it leads to the MI. The lack of blood supply will lead to ischemia and eventually necrosis of the myocardium. If significant loss of muscle tissue occurs, the heart muscle will be unable to pump effectively and cardiac output is reduced. That continues on page 462. What is a troponin? What is a normal value? We can see this on page 470. And look at table 20.2, laboratory tests performed to determine myocardial infarction. Look at troponin I and troponin T. A normal value of troponin I is less than 0.3 micrograms per liter, and a normal value of troponin T is less than 0.1 micrograms per liter. What is an important patient teaching point for the patient newly prescribed simvastatin? We can see this on page 464 within the purple clinical cues box. Because statins can injure muscle tissue and are toxic to the liver in some patients, blood should be drawn for levels of creatinine kinase and for liver enzymes. Elevated liver enzymes can indicate toxic damage to the liver. Patients should be taught to report any unexplained muscle tenderness or pain persisting for more than a few days. When a statin drug is started, baseline blood values will be obtained before therapy. Lab tests for liver enzymes are recommended at the start of therapy and then again only when clinically indicated. Grapefruit juice should not be consumed when taking a statin drug. Grapefruit juice will interfere with the metabolism of the drug, which can lead to increased serum levels and the risk of toxicity. Also see on page 465 within table 20.1 drugs used to treat hypercholesteremia. See simvastatin and the nursing interventions. You should teach the patient to notify the provider if any severe muscle pain and weakness occurs. List some strategies for patients to lower fat and cholesterol in their diet. We can see this on page 466 within the red nutrition considerations box. One way to lower fat and cholesterol within the diet is to eat fish with omega-3 fatty acids at least twice a week. This would include salmon, mackerel, and tuna. How should sublingual nitroglycerin be stored in the home? We can see this on page 469 within the purple clinical cues box. Sublingual nitroglycerin tablets should be kept in a cool, dark place, and they should be carried by the patient at all times. Describe stable angina versus unstable angina. So we can see that on page 466. Stable coronary artery disease can be induced by stressors like exercise or emotion. It will occur spontaneously, but it is relieved by rest. Unstable angina is typically not relieved by rest, and it will continue to persist despite the administration of nitrates such as nitroglycerin. And we can see signs and symptoms of coronary artery disease on page 462. This would include chest discomfort, a feeling of tightness, aching and burning, chest pain, dyspnea, palpitations or tachycardia, nausea and vomiting, undue fatigue, and weakness or inability to complete usual daily activities without any chest pain or dyspnea. List signs and symptoms of coronary artery disease. And so you can see those on page 462. I just read them off in box 20.1. How soon can the patient ambulate after a cardiac catheterization using an arterial closure device? We can see this on page 475. The patient can be up and about within 2 to 4 hours after an arterial closure device has been used to seal the procedure site. Describe the purpose of alteplase, tenecteplase, and retiplase. We can see this on page 471. Agents used intravenously to dissolve the clot include alteplase, tenecteplase, and retiplase. These drugs are contraindicated in patients who have had severe, uncontrolled hypertension or with a history of hemorrhagic stroke, GI bleed, intracranial or intraspinal surgery within the past 2 months, a brain tumor, AV malformation, or aneurysm. So those are the contraindications to thrombolytic therapy for the next bullet point. And those medications, alteplase, tenecteplase, and retiplase, are all standard thrombolytics. And you can see that on page 471, continuing on to page 472. Why is a stool softener prescribed to the patient recovering from a STEMI? We can also see this on page 472. A stool softener will be given to decrease the risk of bradycardia. This can be caused by straining to have a bowel movement. What is a priority intervention after a patient has undergone a PCI using angiography dye? So we can see this on page 475. Renal function should be monitored due to the potential adverse effects of contrast dyes used during the procedure of a PCI. The nurse should encourage fluid intake post-PCI with angiography. It is important for patients recovering from any type of angina or MI that they should gradually increase their physical activity according to their individual condition and their response to activity. And remember that we would assess their response to activity using their heart rate, blood pressure, and respirations, as well as their cardiac rhythm. Chapter 9, Drugs Affecting the Renal, Urinary, and Cardiovascular Systems. This is in the Introduction to Clinical Pharmacology textbook. The renal, urinary, and cardiovascular systems work together to do what? We can see this on page 134. Interactions between the renal, urinary system and the cardiovascular system help to maintain fluid balance, delivery of nutrients, and removal of waste products from cells, tissues, and organs. Many of the drugs that affect one of these systems will also affect the functioning of the other. How do thiazide diuretics work? We can also see this on page 134. Thiazides and thiazide-like diuretics work at the end of the ascending loop of Henle and the beginning of the distal convoluted tubule in the nephron. This class of drugs will increase urine output by preventing water, sodium, potassium, and chloride from being reabsorbed into the blood through the walls of the nephron. As a result of this, water and electrolytes stay within the tubules, making their way through the renal system into the bladder and then being excreted from the body. So in simple terms, thiazides and thiazide-like diuretics function by reducing blood volume. What is a major adverse effect or potential side effect of all diuretics? We can see this on page 137. Diuretics increase urine output, and as a result, dehydration is a major adverse effect. What is an important teaching point for patients on diuretics? This could apply to almost any prescription drug. We can see this on page 138. Patients should be instructed to take the drug exactly as prescribed. Do not skip or double any doses. What is a very common side effect of nitrates? We can see this on page 155. Throbbing headaches caused by rapid blood vessel dilation in the head and face will occur in more than 50% of patients who take nitrates. These headaches will usually occur very quickly after taking the drug and typically will go away quickly if the patient is taking low doses. What is a very common side effect of ACE inhibitors? We can see this on page 150 within table 9.6, common antihypertensive drugs. Notice the ACE inhibitors and the nursing implications. Some patients may experience a dry cough while taking ACE inhibitors. If so, report this to the healthcare provider, who may switch the patient to an ARB because they will not cause a cough. What is an important consideration for male patients taking finasteride who have a pregnant wife? We can see this on page 139 within table 9.2, common drugs for BPH. Notice finasteride or Proscar and the nursing implications. You should warn patients and family members that pregnant women should not handle or touch these drugs because they can cause birth defects when absorbed through the skin. Teach men who are having sex with a pregnant woman to wear a condom to prevent exposure to the fetus because this drug will be present in seminal fluid. What about a pregnant nurse scheduled to administer this drug to a patient? So as we just read, the pregnant woman should not touch these drugs because they could cause birth defects when absorbed through the skin. So a pregnant woman should not be the appropriate nurse to administer that drug to the patient. You should ask your buddy to do that for you. What is an important part of the assessment prior to giving a patient nitrate drug therapy? This is something every single one of you should know because we talk about it every single shift at clinical, but we want to assess those baseline vital signs. Most importantly, our blood pressure, rhythm, heart rhythm, and of course pulse. We can see this on page 156. It is important to get a baseline assessment of heart rate and blood pressure before giving a nitrate drug. For patients with acute angina, you must get a good description of patient symptoms, including the onset, duration, and characteristics of their pain. So perform a thorough pain assessment. Ask the patient if they've ever had pain like this before, and if so, what did they do to relieve the pain? How should sublingual nitroglycerin tablets be stored at home? So we can see this on page 157. Keep the nitroglycerin tablets in a dark glass container to prevent breakdown of the drug. So you should store them in the original container it comes in, because it will come to you in a dark glass container. How often should the patient's blood pressure be checked when administering sublingual nitroglycerin? We can see this on page 156. Evaluate the patient's blood pressure carefully after giving any nitrates until you are sure about the patient's typical response. For sublingual nitroglycerin, you must monitor blood pressure every 5 minutes until the pain is relieved or until emergency care providers have arrived to transport the patient to the acute care setting. So remember that we assess vital signs, we do a full pain assessment, and then we administer the sublingual nitroglycerin. Approximately 5 minutes later, you should be checking that blood pressure, and you repeat that process for each time you administer the nitroglycerin, typically for a maximum of 3 doses. How should sublingual nitroglycerin tablets be taken? What if the patient chews it? So we can also see this on page 156. Remind the patient that the drug is absorbed under the tongue. It should not be chewed or swallowed. Also see on page 156 the purple top tip for safety. Teach your patients not to chew or swallow sublingual nitroglycerin tablets because the drug will be destroyed in the GI system and will not help the angina. Can a patient on statin drug therapy drink beer with dinner? So we can see this on page 143 within table 9.4, common HMG-CoA reductase inhibitors, also known as statins. See the nursing implications. You should teach patients to avoid alcohol because drinking alcohol puts stress on the liver. So is it okay for the patient on statin drug therapy to drink beer with dinner? No, we do not recommend that they do that. Should patients on loop-sparing diuretics increase their daily potassium intake? So patients taking potassium-sparing diuretics should not necessarily increase their sodium intake, and we can see this on page 135. Potassium is one of the major electrolytes that can be lost after loop diuretic administration. You should monitor potassium levels carefully because significant changes in potassium can result in cardiac dysrhythmias. So a loop diuretic or a thiazide or thiazide-like diuretic, you want to have the patient take 1 high potassium food each day. For a patient on a potassium-sparing diuretic, they should be avoiding those high potassium foods. So patients on loop diuretics should have at least 1 high potassium food item per day. A patient on a potassium-sparing diuretic should not. List some food sources that are high in potassium. So we can see that on page 138 within box 9.1, foods with very high or high potassium levels. Notice the banana has a very high potassium level.